You're here for facial rejuvenation, right?
Mm-hmm.
So here's a mirror. So typically we look at what we need to do together. So tell me what bothers you the most when you're looking in the mirror.
So these lines.
So that's the nasolabial fold here and here. Okay. And anything else?
This.
These lines.
Mm-hmm.
Okay. And when at rest, does that bother you?
Yes.
Okay. And has that been getting worse?
Yes.
Okay. Okay. Anything else?
That's most of it.
Okay. So do the colors bother you? Are you beginning to see some of these red?
The under eye darkness is a lot.
The darkness? Okay.
Mm-hmm.
So it's very typical. Almost 99% of the individual that come in here when we talk about facial rejuvenation, they have the same sort of characteristics of aging, right? So what you pointed out is there's three things that causes the stuff that sort of bothers you, right? So the first thing, addressing your nasolabial fold, one of the things that starts to happen after the third decade of your life, you start losing volume in your mid-cheek area, like here and here, right? And you start losing some volume, around this area as well. So as you lose volume here, you have skin, and then sort of the volume goes away, and then the skin kind of just, there's excess skin that's left over, right? And since we live on Earth, there's gravity, so then with the extra skin, you also get what we call descent. So everything just kind of falls this way, and then you sort of have this frowny shape, right? So you kind of go this way, and that's where these nasolabial folds starts to bother you and stuff. And you'll start to see a little bit of volume loss here
Mm-hmm.
and here, and you're starting to see a little bit of downturn
Mm-hmm.
of the corners of your mouth, okay? So that's sort of the volume issues. That's the first, what we call deflation, the first D, and then we explain the second D, which is the descent, with all the skin kind of coming down. The third D is really the deterioration of your collagen and elasticity. So these lines that bother you is because when you lift your eyebrows, right, you're contracting all the muscles, and the muscle is actually moving the skin as well. And when you relax, typically if you have a healthy collagen elasticity in your skin, those lines should go away. So if you look at babies, when they smile, they fold lines, but when they go away, like they bounce right back, and it's completely smooth, right? And it's the same thing with the nasolabial fold. You're seeing these resting lines because when you smile, so you see how you're folding these skin, and when you rest, then it doesn't bounce back. Okay, so that's a combination of collagen deficiency and volume loss. So the way we do rejuvenation here, you really have to address all those three things to get a full facial rejuvenation. Sure, we can break it down by relaxing the muscles so we make these lines better, but we're not really doing anything for improving the skin, right? But if we just give you energy devices or do some biostimulant injections, so we're improving your skin texture and collagen, you're still moving the muscle at the time, so the skin can't really recover. So you sort of have to do combination treatments to actually get, the full facial rejuvenation. So what we like to do are sort of what we call Glow Lift. Is a combination of minimally invasive, just injectable things. So what do I mean by that? Well, you need some energy devices to kind of tighten the skin and stimulate the skin to produce collagen. So that's what radio frequency comes in. So we can actually inject heat into areas that you need rejuvenation. Second type of injections that we oftentimes do is biostimulants. So it can come in the form of a product like Sculptra, or it can come in a product of your own autologous blood. So we draw your blood and we spin it down and it turns into platelet-rich fibrin, and which has got a consistency of like a filler, so we can inject and then give you your own growth factors back where you need volume and rejuvenation. So we oftentimes do that in the mid-face area, to kind of give you more volume in the cheek area to lift that up. We may need to do some supraorbital buttress that can help you lift the eyebrows to lift everything up. So everything goes that way, okay? And then as far as your nasolabial fold and sort of the perioral area, once we give you volume back on your cheek, then we can give you some volume in this area to help support that. And we do all of that with the PRF, if that's one way, or there can be a combination of PRF or some dermal fillers and stuff. And then of course, lastly, we can inject neurotoxins to relax those depressor muscles that force our face to kind of be downturning. So if we inject the muscles to relax the depressor muscle, the levator muscle will just naturally lift your face up. And with the rejuvenation of the skin and rejuvenation of the collagen, that's how you get a full rejuvenation. Now, another injectable that we often offer our patients, which you would be a good candidate for, would be the threading. So after we do all that, it takes time for your body to build up the collagen and the elasticity and the new tissue. So while that's happening, we can also inject or place some threads that can actually help lift like that while your body is developing the collagen and elastin with the PRP and stuff. So that is our complete sort of 3D rejuvenation for a minimally invasive facelift. Okay, not everybody's a candidate. So prime candidate is individual in your age group, somewhere in the mid-30s to mid-40s, with still some collagen left, but we're beginning to see some collagen deficiency and stuff. And the resting lines and the skin texture is not too bad. And if you were to wait, and then you go into your 5th and 6th decade and you don't do anything around this time, that's when those edge lines become very difficult to treat. And that's when you may need like a complete laser resurfacing of your face to erase those lines. And that has a significant downtime. Usually it's a 2-week downtime where you really can't go out. And then it takes another 2 weeks for the redness to go away. With this procedure, it's all done in the office. It takes about an hour. You'll get some swelling tomorrow, but within 24-48 hours, you'll be back to normal. And tomorrow, you just have a little bit of swelling, but you can still go to work, put makeup on, and so forth. So it's really minimal downtime, and it doesn't really disrupt your social sort of life. And you'll get maximum results in 3 months. That's the full effect of all the treatments that we do. And you'll have a healthier skin at the end of the treatment and stuff. So that's what I would recommend the treatment be. Okay. All right. So the first step that we normally do is we do some local numbing so that we can do radio frequency injections. And that's really in the form of what we call Accutite. It's a little device that we put underneath the skin and we kind of heat it up inside from the outside. After we do that strategically, probably supraorbital area, your jaw area, and around your nasolabial fold. Those are the 3 areas that I would treat. And then after that, we'll do the easy gel injections. Usually we'll draw blood. You'll get about 5 to 6 cc's. We'll start from the top. We'll definitely give you some PRF underneath the tear trough area because you're lacking some volume there, and then that would help rejuvenate the color and the skin. And then obviously your malar fat pad area, and then your cheek area to help you, sort of your zygomatic arch to help you lift. Once we open that up, then we can give you some volume in the nasolabial fold perioral area, and then hopefully we can restore your face to be more of a apex opposite triangle type of shape. So that's what we call a youthful look for women. Okay?
Okay.
Great.